Hey guys, welcome to another video. Yesterday, I was seeing one of my patients in the pulmonary clinic, and she was asking me about my thoughts about getting the COVID vaccine. She also asked me if I heard about the doctor in Florida who died after getting the first Pfizer vaccination. So, this is something I want to talk about. So, there was an obstetrician gynecologist in Miami who received the first dose of the Pfizer vaccine on December 18th. And shortly after receiving the vaccine, he reportedly developed acute immune thrombocytopenia. He died 16 days after getting the vaccine. His cause of death being a result of brain hemorrhage or bleeding into the brain. Obviously, this is horrible, it's tragic, and you have to feel for his family. But it makes you wonder, was his death a result of the vaccine? And if it was a result of the vaccine, should that change your perspective on getting the vaccine? So I'm going to tell you my thoughts on this, but first, let's learn a little bit more about what happened. Pfizer is actively investigating the case, but they don't seem to think that the vaccine is the cause of this. So far, over 10 million people in the United States have received at least one shot of either the Pfizer or the Moderna COVID vaccine. These are the two authorized in the United States as of right now. Me personally, I received both doses of the Pfizer vaccine, which overall went very smoothly. Now, so far, there have been about 40 cases of anaphylaxis as a result of these vaccines, meaning a severe allergic reaction, none of which were reported as being fatal. Now, many people have had other side effects that are very common after the vaccine, like having a sore arm, having some fatigue, headache, or fever, and this typically lasts a day or two. The Miami-Dade County Medical Examiner's Office is investigating this death as well, and as of right now, there is no official autopsy report. But based off the reports, let's see what we can make of this case. So this man was healthy. He did not smoke, he did not take any medications, never had any reaction to any medication or vaccines. Supposedly, 3 days after he gets the first dose of the Pfizer COVID vaccination, he gets tiny reddish spots or petechiae caused by bleeding under the skin of his hands and feet. This prompted him to go to the ER. He gets blood work done, and his platelet levels are low, and this is something called thrombocytopenia. Platelets are one of the components of blood clotting. If platelets are too low, it makes people more prone to bleeding. Normal platelet counts range from anywhere from 150,000 to 400,000 or so. People can have spontaneous bleeding, including internal bleeding, but that doesn't typically happen unless the platelet levels are less than 10,000. His levels were reportedly zero, and because they're so low or absent, really, he gets admitted to the intensive care unit. For 2 weeks, doctors tried to get his platelet count higher, as he had experts from all over the country involved in his care. Now, presumably, they tried a number of different treatments. Typically, we give platelet transfusions, which is really a blood product that we're transfusing, but also we give steroids, specifically glucocorticoids, such as Solumedrol or methylprednisolone. If that doesn't work, we try other drugs like romoplastim or eltrombopag to try to stimulate the bone marrow to make more platelets. Sometimes we give immunoglobulins, sometimes we give a drug called rituximab, which is a monoclonal antibody. If all else fails, the last resort is to take out the spleen, because sometimes the spleen plays a role in sequestering and destroying platelets. So they were actually planning on doing a splenectomy, meaning removing his spleen, but shortly before that, he ends up developing a hemorrhagic stroke that took his life in a matter of minutes. In other words, he bled into his brain. Now, just because someone bleeds into their brain, it doesn't necessarily mean that they die. But what happens is, if the bleeding is severe enough, the pressure starts building up inside the skull, and this is known as raised intracranial pressure. And this compresses the brain, and eventually the pressure forces the brain down through the base of the skull, that big hole at the bottom of the skull known as the foramen magnum. When this happens, the only life-saving option is emergent brain surgery, where a neurosurgeon does a craniotomy to relieve the intracranial pressure. But his bleeding was so severe and happened so quickly, it took his life. And his thrombocytopenia was not only severe, but it wasn't getting better despite all the treatments that they tried. And this leads to the question, why does a healthy guy all of a sudden get severe thrombocytopenia to the point of bleeding to death? Because no matter what the cause is, this kind of thing is incredibly rare. I've never had a similar case like this in the intensive care unit. Now, there are some cases like this reported with certain drugs. Medications can lead to thrombocytopenia as a result of drug-induced antibodies being made by the immune system that end up attacking the body's platelets. So, drug-induced thrombocytopenia refers to acute immune-mediated thrombocytopenia, and it should be suspected when someone has a sudden severe thrombocytopenia. So, DITP, or drug-induced thrombocytopenia, is even more strongly suspected when a patient has repeated episodes of a sudden, severe drop in the platelet count. By far, the most common drugs that cause this are things like quinidine, the blood thinner heparin, and then also sulfonylureas like trimethoprim sulfamethoxazole, aka Bactrim. And also there's other antibiotics that are fairly common that cause this as well. So it's not just drugs that can cause this, but also certain foods, herbal remedies, and one vaccine, the MMR vaccine. The risk of ITP occurring within 6 weeks after getting the MMR vaccination is increased. However, the attributable risk of thrombocytopenia within 6 weeks after MMR vaccination remains overall low at 1 in 25,000 vaccinated children. Now, complications or long-term consequences of ITP in this age group are rare. For the majority of children less than 6 years of age, the illness is self-limiting. Vaccines stimulate the immune system and, in theory, could, in rare cases, cause it to mistakenly identify some of a patient's own cells as enemy invaders that should be destroyed. But with that said, millions of various vaccinations are given every year, and clusters of thrombocytopenia don't occur. And regarding the COVID vaccine, millions of doses have been given, and so far, there are no other reports or associations with low platelet counts. So did the Pfizer vaccine cause this? Based on the timing of things, it seems like it, but it's too early to come to a conclusion one way or another. We have to know all the facts and understand the autopsy report, but even then, it's still not a guarantee that we come to a solid conclusion. Although this is an incredibly sad story, and even if it does prove that the vaccine did cause this, I hope people aren't dissuaded from getting the vaccine because this type of thing is still very incredibly rare. Every decision we make in medicine is based on risk versus benefit. And when you compare the risks of COVID and the risks and benefits of the vaccine, the benefits outweigh the risks for the vast majority of people. In fact, there are lots of COVID patients in the intensive care unit that have thrombocytopenia, so that is something else to put in perspective. Knowing more details about this case might help us to better devise treatment plans in case this happens again in other people after they get the vaccine, but I doubt we're going to hear many more cases like this. Anyway, that's all I have for this video. Thanks for watching, and I'll see you in the next one.